I was on a treadmill, and I had an odd sensation in actually more in my throat. And it was so unique that I got off the treadmill and I called Metro Heart and said, I feel weird. They said, well, this is good news, bad news. The bad news is you're going to go in the hospital and have open heart surgery. The good news is we found it. For the first time in your life, you go, uh-oh, I guess I'm not going to be the one that's going to live forever. And it's scary. I have both my granddaughters here. At the time this happened, one was 3 months old, and I never would have gotten to see the other one. And believe me, when you think of it in those terms, it's amazing how lucky we are to have this service available and these wonderful people that, you know, saved my life. I never would have seen my grandkids.
We have these tools that we use, the technology to take care of patients. And some of the proposals are going to limit our ability to use those tools.
I'm aware that in 50% of the cases, the first symptom of a heart issue is death.
By the time you get to a cardiologist or a specialist, the most cost-effective care is to allow us to have the tools we need to treat the patients appropriately right then and there.
Somebody says to you, well, I know you feel funny, I know your body's telling you something. Do you mind waiting 10 days till, you know, we can fit you in? Well, that can't happen. Well, it can happen. Again, in my case, I would be dead.
And so what the policymakers need to do is decide what's going to happen as a result of this legislation. Is it going to make it more challenging for cardiologists to get the test?
I would say that that's a very bad idea to pool those resources and to subject people to waiting.
The most cost-effective care is the right care, done at the right time. So if I see a patient with chest pain, I need to be able to pick and choose the test that I need to diagnose that patient quickly and appropriately.
Oh, I'm doing great. I work out every day. I'm quite religious about it. And I work out because I can. You know, I've been given this new life, so to speak, and I'm grateful that I have it, and I want to, you know, take advantage of it.